This recorded lecture will be going over Chapter 35, administering intradermal, subcutaneous, and intramuscular injections in the Fundamentals textbook. Being asked to give an injection, which is forcing fluid into a part of the body, to another person will make many nursing students apprehensive. Ways to decrease your anxiety will include focusing on the beneficial effects of the medication you're administering, developing dexterity in administering the medications, practice, and of course more practice in the skills lab. Learning the sites for injections is necessary for safety. Intramuscular, or IM, is into the muscle. Subcutaneous is beneath the skin layers, or SQ. Intradermal, or ID, is into the dermis layer of the skin. These routes of administration are specific to the type and purpose of the medication being administered. This can be seen on page 688. It's important to pay attention to the layers of the skin and focus on how you would be administering that medication. So topical medications would be going into the epidermis, on top of the epidermis, and then absorbed by it. Our intradermal injections are going to be in the dermis. You see, you'd be going under the epidermis right into that second layer of the skin. And then our subcutaneous injections will be going into that fatty subcutaneous tissue. And you can see how much deeper it is as the third layer of skin, or the third layer of our skin. Parenteral means not delivered via the GI tract. These routes require the use of a syringe or needle, an IV catheter to introduce medications into the body tissues or fluids. Medications that are given parenterally need to be sterile, non-allergenic to the patient, and readily absorbable. Injections are given for the following purposes: when a patient can't take medication by mouth, to quicken or hasten the action of the drug, when a continuous infusion of the medication is necessary, when digestive juices would counteract the effects of the drug if given by the oral route, injectable drugs that have a potential for rapid effects, so observe the following precautions. Make sure that your dose is accurate. Make sure you select the correct site to prevent any damage to the tissues. Be sure to use sterile equipment and aseptic technique to prevent any infection. In some parts of the body, the subcutaneous layer can be more than 3 centimeters thick. The more vascular the tissue is, the quicker the medication will be absorbed. The wrong site or route can cause damage to a major nerve or blood vessel, or even death. This can be seen on page 688 in box 35.1, the principles for safe, effective administration of parenteral medications. Know the medication that you're going to administer and observe for any side effects and the therapeutic action intended. Assess for any drug allergies before administering the injection. Use sterile needles and syringes. Select the appropriate length of the needle to deposit the medication in the proper tissue layer. Label the syringe with the patient's name, the name of the drug, and the dose. Obtain assistance as needed when the patient is frightened, such as a child or an uncooperative adult. Rotate your injection sites for patients receiving repeated injections by establishing a predetermined plan. Select an injection site that is relatively free of hair, lesions, inflammation, rashes, moles, and freckles. Select the injection site carefully to avoid any major nerves, blood vessels, and underlying organs. The intradermal, subcutaneous, intramuscular, and intravenous routes are all used for parenteral medication administration. The intradermal route is used extensively for skin testing, such as tuberculin testing, generally on the inner surface of the forearm. The tuberculin syringe is used for this. Generally, a fine needle, such as a 29 gauge, is used at a 5 to 15 degree angle of insertion. This will create a pool of medication under the thin layer of skin, forming a bleb, which is a bump, a visible elevation in the epidermis. The subcutaneous route is usually in the upper portion of the upper outer arm, the anterior surface of the thigh, or the abdomen where there are no major vessels or nerves. Small amounts of solution, up to 1 milliliters in volume, can be injected subcutaneously with either a tuberculin or a 3 ml syringe. A 27 gauge needle, about 3/8 to a ½ inch length, or a 25 gauge, 5/8 inch needle is typically used. The needle should be inserted at a 45 to 90 degree angle, depending on the needle length and the patient's size. The needle size will also depend on the patient's body size. These sites are used for medications that need slow absorption for their sustained action. The absorption time for IM medications will vary. Aqueous solutions are absorbed more rapidly than those in an oil suspension are. The most frequently used IM sites are the deltoid, ventrogluteal, vastus lateralis, and rectus femoris of the thigh. The angle of injection is 90 degrees, and depending on the patient's size, a needle from 1 to 3 inches in length should be used. You should never inject more than 3 mLs per site. Of course, this also will depend on body size. On page 689, be sure to see the clinical cues in the purple box. Up to 3 mLs can be safely injected in the ventrogluteal, vastus lateralis, and rectus femoris sites in most adult patients. However, the muscle mass of older or thin patients can accommodate sometimes only 2 mLs in a single injection. Larger amounts may be given in one injection in a large adult muscle in some instances. A syringe is composed of a barrel that has a tip to which the needle is then attached, and a plunger will fit inside the barrel. You can see a picture of this on page 690. The needle, the tip, the inside of the barrel, and the sides of the plunger need to be kept sterile. In North America, disposable syringes are used almost exclusively because they are convenient, safe, and economical. The 3 ml syringe is popular because it is large enough for subcutaneous and most IM injections. The insulin needle is part of the syringe and is not removable. Tuberculin syringes are 1 ml in size and are calibrated to measure drug dosages so small such as 0.01 mLs. Syringe tips are also a consideration. For example, a Luer lock tip would be the choice for an IM injection because the locking mechanism will prevent a sudden separation of needle and syringe when pressure is applied to inject the medication into muscle mass. A few injectable medications are supplied in the form of unit dose cartridges. Some medications will be supplied in a Carpuject system. The syringe chosen for the injection needs to have a measurement scale that is appropriate for the required dose of the medication. A 3 ml syringe would measure tenths of a millimeter, so 0.1s. You can see this picture on page 690. It's important to remember that the needle, the barrel, and the plunger need to be kept sterile. You would need to avoid touching them. So you would only touch the outside of the barrel and the top of the plunger where you would need to push so that you could push the medication in. So very important to only touch those parts and be familiar with the parts of a syringe and how they work. You can see this picture on page 691, measurement scale on a 3 ml syringe. And important to be familiar with that, to know where your measurements would be. If you were going to give 0.8 mLs, where would you give that on this syringe? So go ahead and locate that for yourself now. And how about what if we were to give, let's say 2.2 mLs of a medication? Where would you locate that on this syringe? Also on page 691, you can see some insulin syringes. Insulin syringes will go up to 50 units or 100 units, depending on how large of a dose you are giving. Also dependent on the type of insulin, of course, that we are giving, because insulin will have different peaks and strengths and onsets, which is very important to consider whenever giving it. And then also on page 691, a tuberculin syringe, and this would typically be used to give very small doses of medications. A needle consists of a hub fitting onto the end of a syringe, a hollow shaft, which is called a cannula, and a bevel. This is the slanted part of the needle tip. It ends in a very sharp point. The inner part of the cannula is called the lumen. Needles are generally disposable and need to be discarded immediately after use. Needles are available in standard sizes, measured in gauges from 13 to 30, although an agency may not buy all of those sizes. The larger the number of the gauge, the smaller the needle will be. Most often 1 or 1.5 inch needles are used for adult parenteral injections. Adult IM injections will frequently use 22 and 23 gauge needles. You can see some different needle sizes here. Notice that the different hubs are all different colors. That is also very typical. You will also begin to be able to identify your needle lengths and sizes by the colors of their hubs. For example, within Bacare, 20s are going to be pink, a green is going to be an 18, blue is going to be a 22, and so on and so forth. A needle stick occurs anytime a needle accidentally pricks the skin. The danger of the spread of HIV, hepatitis B virus, and hepatitis C virus has created much concern about needle safety. Various safety devices have been developed to dispose of used needles safely. Always use the needleless option to draw up medications whenever it's available. Learning to use these safety features will precede preparing medications or practicing injections. If you need to use a needle to draw up a potentially irritating medication, the needle needs to be changed to a new safety needle prior to injection to eliminate any possibility of depositing the medication in the surface tissue. Typically, blunt tip needles are used to draw up only, and then you would switch that needle out for the needle you're going to use to actually inject into your patient. If a needle stick does occur, thoroughly wash the puncture wound with soap and water. Report to the charge nurse immediately. Then complete an incident or occurrence report and follow your agency policy for treatment and follow-up care. In the immediate environment, you should attempt to develop a conscious awareness of where contaminated needles might be left or carried by other healthcare workers in order to prevent any needle stick injuries. On page 692, see the safety alert, reducing needle stick injuries. Recapping is not recommended for used needles. All syringes and needles are dropped, not pushed, into a sharps container immediately after use. If a sharps container is not available in each patient's room, notify the nurse manager. Leave your needle uncapped and drop it in the sharps container. You do not recap needles. Only in very specific rare circumstances, like for example when you're preparing a medication, and for that we would use our one-handed scoop method, and we will be practicing that in clinical and in the lab. In preparing to give an injection, the first step is to select the appropriate size and type of the needle and syringe for the medication to be given and for the patient's age and size. For giving IM injections, the 3 ml syringe and a 22 gauge, 1.5 inch needle are generally used. A tuberculin or 3 ml syringe and a 27 gauge, 3/8 to 1/2 inch or 25 gauge, 5/8 inch needle are used to give subcutaneous injections. When preparing syringes for use, you should be certain to observe the following principles. Use aseptic technique in handling the syringe and the needle. Protect any surfaces that need to remain sterile, which include the needle, the tip, the inner barrel, and the plunger. Discard the syringe or needle if it becomes contaminated during drug preparation for administration. Label the syringe with the patient's name, the name of the medication, and the dose. Do not administer medications to patients using the same syringe, even if the needle is changed between patients. Medications for injection are dispensed in various kinds of units, such as glass ampules containing a single dose vials, mixo-vials, and multiple dose vials. Parenteral medications need to be kept sterile. Ampules are made entirely of glass or polyurethane and contain a single standard dose of the medication. Most ampules are pre-scored on the neck so that the glass will break more evenly with slight pressure at that portion. To move the medication, tap or flick the stem several times with a finger to free the trapped solution. Before breaking open the ampule, you should wrap the neck with a rubber ampule guard, an alcohol swab, or a gauze pad to avoid any accidental cuts. Press the thumbs outward against the neck so that the ampule breaks outward away from you. Always use a filter needle to withdraw medication from an ampule because small particles of glass could fall into the medication when the ampule neck is removed. Filtering needles should never be used for injection on a patient. A vial is a small bottle with a rubber stopper attached with a metal band. A vial can contain one or more doses of a medication. The desired amount of medication is removed by inserting a sterile needleless device or the needle of a syringe through a rubber stopper into the liquid, with the vial inverted, drawing up the solution. Do not put a medication vial into your pocket and discard any vials that might have been contaminated. Drugs that are unstable in solution are prepared in a powdered or solid form. The solute or solid material in the vial is then mixed with a diluent, a specific fluid to dissolve that solute, before the drug is drawn up into a syringe. Sterile water and sterile normal saline are typical dilutants. The label or the drug insert package with the vial will provide the instructions about the type and the amount of diluent to use. The solute must be thoroughly mixed with the diluent before use. The label on the vial will indicate the amount of medication per volume after the correct dilution has occurred. Not all drugs are compatible with others when they are mixed together. When medications are compatible, as with different types of insulin, you inject an amount of air equal to the desired dose of each drug into their respective vials. This will reduce the vacuum inside the multi-dose vial and make it easier to withdraw the medication. A good example of some medicines that are compatible and can be done in this way are morphine and Zofran. Once the drugs are mixed in the syringe, there is then no way to separate the excess. Occasionally, a patient might need several injectable medications. If those medications can be combined, the patient will then only have to endure one injection. However, before combining 2 or more drugs in a syringe, always check with the pharmacist or consult a drug reference for compatibilities. An allergy to an injectable medication that goes into the tissue or bloodstream could result in anaphylaxis. Check the expiration date on the label of the medication container before drawing it up. Determine the reason that the patient is receiving this medication. Determine the medication's desired action, potential side effects, precautions, and recommended nursing interventions. It is imperative to know both what the medication is supposed to do, which is the therapeutic action, and what adverse or side effects may occur to assess the patient for their presence properly. If harmful side effects have occurred, the medication must be discontinued and the primary care provider consulted. Determine previous injection sites by consulting the MAR or the EMAR and the patient. It's best to rotate your injection sites, especially with insulin. This is to promote the best absorption of the medication and decrease any tissue irritation, or lipohypertrophy, which is formation of fatty lumps under the skin that can be caused by insulin injections. The needle size and length are determined by the type of injection to be given, as well as the size of muscle tissue and the amount of fat at the patient's injection site. Adequate circulation is essential for drug absorption. It is necessary to use your clinical judgment to choose the correct needle size and syringe for the type of injection to be given. Always follow the 6 rights when administering a parenteral medication. These are the right drug, the right route, the right dose, the right time, the right patient, the right documentation. Once disposable needles and syringes have been used, they must be discarded in such a way that they cannot pose a danger to others. For the intradermal route, a small amount of solution is injected. The maximum amount of medication for this route is 0.1 mL. The injected solution will raise the epidermis to form a bleb. A positive tuberculin test denotes that exposure has occurred, but it does not signify the presence of active disease. A follow-up of a positive tuberculin test result will include a chest X-ray examination and possibly another blood test. It's important when administering intradermal injections to inject the solution slowly to form the bleb. On page 700 in box 35.2, see the information on reading the tuberculin skin test. The result needs to be read between 48 and 72 hours after the initial injection. The subcutaneous route is used for a variety of medications, including insulin, heparin, and some preoperative medications and narcotics to relieve pain. Heparin is given in the abdominal subcutaneous sites. The best site for insulin is also the abdomen because it provides the most reliable, steady absorption. Teach your patients with diabetes to rotate their sites for insulin administration and, if ordered, how to use an insulin pen. On page 702 in box 35.3, see the subcutaneous injection sites in figure 35.17. Very important to become familiar with those injection sites because they would be the only sites appropriate for giving our subcutaneous injections. Also see the subcutaneous administration of heparin in box 35.3. Sites on the abdomen from below the costal margins to the iliac crest are used because this area is not involved in muscular activity, whereas the arms and legs are. Sites should be rotated within the abdominal area, alternating from one side to another. Avoid giving a subsequent injection too close to a previous one. IM injections are used if the patient cannot take medicine orally, the medication is not prepared in an oral form, or a faster action is desired. Selection of the injection site is a critical decision. Improper selection can result in damaged nerves, abscess, necrosis, slowing of skin, and pain. Consider the individual's stage of development, their body build, and physical condition, along with the viscosity and amount of drug to be administered. If more than 3 mL of medication must be given at one time to an adult, the dose should be divided in half and then given in 2 different large muscle sites. The mid-deltoid muscle is a common location for the IM injection. The correct site for injection can be located by placing 4 fingers across the deltoid muscle, With the little finger on the acromion process, the site is 3 finger widths below the acromion process. This site is convenient because it's usually easily accessible. However, it's not used in infants or children with their undeveloped muscles. In the past, dorsogluteal or gluteal, meaning the buttocks, site was used. Evidence practice has now changed this. It's no longer recommended due to the high potential for injury to the sciatic nerve and the surrounding blood vessels. The ventrogluteal area is the preferred IM injection site. It involves the gluteus medius and minimizes any muscle involvement. To locate this injection site, place the palm over the greater trochanter and put the index finger over the anterior iliac spine. Then spread the middle finger as far as possible towards the posterior iliac crest. The center of the V, bounded by the index and middle finger, is the precise injection site that needs to be used. You can see this on page 705, and this is going to be the deltoid IM injection site, very commonly used. You can see this on page 707. This is the site for the ventrogluteal IM injection, also very commonly used. This is on page 708. This is going to be the vastus lateralis IM injection site. This provides you with a side view and a front view. Again, very important, very common injection site. And then also on page 708, we have the rectus femoris IM injection site. The vastus lateralis muscle is also a preferred IM injection site for adults, children, and infants because it is easily accessible and free of major nerves and blood vessels. The rectus femoris muscle can also be used as an IM site in the adult, as well as when other sites are contraindicated in children. It is located on the anterior aspect of the thigh and is used by people who give their own IM injections because it's very easy to reach. The disadvantage of this site is that the injection may cause considerable discomfort. On page 708 in box 35.4, see the ways to decrease injection discomfort. It's important as nurses that we use the smallest gauge needle that is appropriate. The needle size and the angle of the injection will depend on the size of the infant or child. For infants, a 5/8 inch needle should be used, whereas for older children, a 5/8 to 1 inch needle can be used. An adult can take a 90-degree angle. A child or smaller person might need a 45-degree angle for an injection. When giving a deltoid injection to a child, the injection in the thickest part of the muscle should be used. The needle should point at a slight angle towards the shoulder. IM immunizations for children older than 13 months of age can be given in the deltoid site. Knowledge of the various stages of child growth and development will enable you to give an appropriate explanation to the child and provide emotional support before, during, and after the injection. Your manner can help reassure the child. After the injection, talk in a soothing way and cuddle the child to reestablish the trust. Children will thrive on praise and rewards. Nurses are encouraged to use the Z-track technique. This will cause a needle track or a pathway in the shape of a Z. Use this anytime an IM injection is given to prevent any leakage and associated pain. The Z-track technique must be used whenever a deep IM injection of iron dextran and other irritating solutions such as hydroxyzine hydrochloride and several antipsychotic agents are given. Always check the drug insert that comes with the medication to see whether or not you need to do this. Or it could just be best practice to do this every time you perform an IM injection. For me personally, every time I perform an IM injection, I am using my Z-track method. When an allergen is taken by a sensitized person, the reaction can range from mild to severe. In fact, death can occur within minutes. An anaphylactic reaction can result in death, and symptoms include urticaria, which is a reaction characterized by reddened, elevated patches known as wheals, bronchiolar constriction that manifests as wheezing or difficulty breathing, edema, and finally, circulatory collapse. Oxygen supplementation, cardiopulmonary resuscitation, or the administration of emergency drugs might be necessary. Some allergic reactions might occur for up to 2 weeks after the medication was administered. Allergic reactions are more common the second or successive times that the medication is received. On page 710, see the safety alert. Watch for allergic reactions. Critical nursing responsibilities when administering a parenteral drug are to check for allergy to the drug before administration and to observe the patient for 30 minutes after the drug has been given for the first time. For drugs such as antibiotics, if no improvement is seen within 2 to 3 days, you should notify the primary care provider. Always leave your patient in a safe and comfortable position. Injection documentation should include the medication, the dosage, the route, and the site at which the injection was given.